Lawmakers have moved on to the second vote in the series now. 5-minute vote on the rule debating this oil and gas production measure. They will finish up this series with a motion to instruct conferees to file a transportation bill conference report by this coming Friday. After that, we expect 2 hours of general debate on oil and gas production, along with the 27 amendments that are up to be considered. The Senate's in session today. They've been working through a list of amendments to the Farm Bill and nutrition programs. There could be final vote on final passage later today. You can see the Senate on our companion network, C-SPAN 2.
resolution is adopted. Without objection, a motion to reconsider is laid on the table. The unfinished business is the vote on the motion to instruct on H.R. 4348, offered by the gentleman from Minnesota, Mr. Walls, on which the yeas and nays were ordered. The clerk will redesignate the motion.
Motion to instruct conferees on H.R. 4348, offered by Mr. Walls of Minnesota.
The question is on the motion to instruct. Members will record their votes by electronic device. This will be a 5-minute vote.
This 5-minute vote is on a motion to instruct conferees to file a transportation bill conference report by this coming Friday. Following this, we do expect 2 hours of general debate on the oil and gas production legislation, with 27 amendments to be considered. At the conclusion of votes here, we do expect members of the House Oversight and Government Reform Committee to resume their hearing on contempt proceedings against Attorney General Eric Holder over refusal to provide documents related to the investigation of Operation Fast and Furious. Today, President Obama invoked executive privilege of those documents. It's the first time he's done that. That executive privilege invocation would prevent access to the committee. You can see those proceedings when they get underway at about 2:45 Eastern, we're being told. It'll be on our companion network, C-SPAN 3.
6. The nays are 34. 1 voting present. The motion is adopted. Without objection, a motion to reconsider is laid upon the table.
Purpose is the gentleman from Maryland rise.
Mr. Speaker, the House is not in order.
Gentleman is correct. The House is not in order. Please take your conversations off of the floor. Please take your conversations off the floor. Would you please take your conversations off the floor, please? Shh. Gentleman from Maryland is recognized.
Thank you, Mr. Speaker. Pursuant to Clause 7C of Rule 22, I hereby give notice of my intention to offer a motion to instruct conferees on H.R. 4348. The motion to instruct conferees reads as follows, Mr. Speaker. I move that the managers on the part of the House at the conference on the disagreeing votes of the 2 houses on the Senate amendment to H.R. 4348 be instructed to recede from disagreement to the amendment of the Senate.
The gentleman's notice will appear in the record.
Thank you, Mr. Speaker.
For what purposes the gentlelady from Tennessee rise?
Thank you, Mr. Speaker. Pursuant to Rule 22, Clause 7C, I hereby announce my intention to offer a motion to instruct on H.R. 4348. The form of the motion is as follows. I move that the managers on the part of the House at the conference on the disagreeing votes of the 2 houses on the Senate amendment to the bill H.R. 4348 be instructed to reject Section 31-108 of the Senate amendment related to distracted driving grants other than the matter proposed to be inserted as Section 411G of Title 23 United States Code related to distracted driving study.
The gentlelady's notice will be recorded in the record.
Thank you, Mr. Speaker.
Pursuant to Clause 8 of Rule 20, the Chair will postpone further proceedings today on the motion to suspend the rules on which a recorded vote or the yeas and nays are ordered, or on which the vote incurs ejection under Clause 6 of Rule 20. Any recorded vote on the postponed question will be taken later. For what purpose does the gentleman from Michigan seek recognition?
Mr. Speaker, I would move to suspend the rules and pass the bill S-3187 as amended.
The clerk will report the title of the bill.
Senate 3187, an act to amend the Federal Food, Drug, and Cosmetic Act to revise and extend the user fee programs for prescription drugs and medical devices, to establish user fee programs for generic drugs and biosimilars and for other purposes.
Pursuant to the rule, the gentleman from Michigan, Mr. Upton, and the gentleman from California, Mr. Waxman, each will control 20 minutes. The Chair recognizes the gentleman from Michigan.
Mr. Speaker, I would ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record.
Without objection.
Mr. Speaker, I yield myself 2 minutes.
The gentleman is recognized.
Mr. Speaker, I want to thank Mr. Waxman, Chairman Harkin, Senator Enzi, and members on both sides of the aisle in both the House and the Senate who played a role in this process. S-3187 is a reflection of the hard work put in by both members and staff, and of everyone's willingness to put partisanship aside to look at the issues together. And because of that outstanding dedication, we have a bill today that will make a real difference in the lives of so many patients and provide much-needed support for innovators across our great country. At the outset of this Congress, I set a goal of enacting this bill by the end of June, and here we are, well before the clock has expired for this month, in order to provide certainty for American patients and innovators. I never lost confidence that we could deliver the bipartisan reforms that we needed, and I am so proud that we will accomplish that goal. Mr. Speaker, this is a jobs bill, and it's a medical innovation bill. And as we put this package together, our goal was to improve the predictability, consistency, transparency, and efficiency of FDA regulation. These reforms will help get new treatments to patients more quickly. They'll help us not only keep jobs in Michigan and all across the country, but also to create new ones. In order to get it right, we turn to patients, innovators, job creators who provided first-hand experience of how the current system is broken, and we included many of their suggestions in the bill. This bill includes significant accountability and reform measures designed to hold the FDA responsible for its performance. The measure includes independent assessments of FDA's drug and device review process. It also includes requiring quarterly reporting from the device center so that we don't have to wait a year to find out FDA's progress. The bill is about patients, and that's why so many patient advocates have spoken out in support of these reforms. Whether it's the steps that we took to support treatments for rare diseases or mitigate drug shortages or speed up the approval of devices that will improve patients' quality of life, these are steps that will make a real and significant difference. They're going to keep the U.S. at the forefront of medical innovation where we belong. This bill is just the first step. This bill provides the resources and the game plan so that FDA can improve its performance. It's now, I yield myself an additional minute.
Gentleman's recognized for 1 minute.
It's now up to the FDA to execute that game plan. And I give my commitment today that our committee will continue to monitor and hold the FDA accountable for its performance. So together, the members of the House and Senate have produced a bill that is a win for American patients, innovation, and job creation. Before I conclude, I'd like to recognize Warren Burke, Megan Renfrew from the Legislative Counsel's Office for their tireless work. The role of Legislative Counsel often goes unnoticed. Also appreciate our staff, starting with our Staff Director, Gary Andres, for pushing this legislation over the finish line, Clay Alspa on the Majority Staff, Rachel Scheer, Minority Staff, in particular, Ryan Long, the Chief Counsel for the Health Subcommittee. This bill, when it becomes law, patients will benefit from faster, newer, better treatments, and American workers will keep us on the cutting edge of medical innovation, and I reserve the balance of my time.
The gentleman reserves. Gentleman from California.
Mr. Speaker, I yield myself 3 minutes.
The gentleman is recognized for 3 minutes.
Today, the House considers a bill that represents a significant bipartisan and bicameral achievement. On May 30th this year, the House passed its user fee legislation by a dramatic vote of 387 to 5. That bill was a strong one, but through our collaborative process with the Senate, we have made it even better. It has been a pleasure to work not only with Mr. Upton, Mr. Pitts, Mr. Pallone, and Mr. Dingell, among many involved House colleagues, but also with our Senate colleagues, Senator Harkin and Enzi. When we began this process, there were divergent views on the various issues contained in this bill, but we worked together and we found ways to bridge our differences in a fashion that protects patients and fosters innovation. This legislation contains many provisions that are critical to the functioning of major parts of the FDA. We reauthorize the FDA's Drug and Medical Device User Fee Program, which will provide resources to enable the efficient review of applications and give patients rapid access to new therapies. We're also reauthorizing 2 pediatric programs which foster the development and safe use of prescription drugs in children. This year, we're establishing 2 new programs to help FDA speed up their review of new generics and biosimilars. These provisions illustrate our bipartisan commitment to ensuring a vibrant generic marketplace, and all of us will see the benefits when more low-cost generics are on the market. One of the most important improvements of the House-passed bill is in the area of antibiotics. We accepted the Senate language that directs incentives for the development of antibiotics towards serious and life-threatening infections. This bill also includes provisions to modernize FDA's authorities with respect to the drug supply chain. Today, 80% of active ingredients and bulk chemicals used in U.S. drugs come from abroad, and 40% of finished drugs are manufactured abroad. FDA is trying to keep pace with this increasingly globalized drug supply chain using an outdated statute. This legislation will give FDA critical new tools to police this dramatically different marketplace. We have also worked to address the area of drug shortages. which is a complex and multifaceted problem, but this legislation takes some sensible first steps. I want to thank my colleagues on both sides of the aisle and their staffs for the hard work they put into making this a strong bipartisan bill. I particularly want to thank Mr. Pallone and Mr. Dingell's staff members, Tiffany Guarocchio and Tim Trezak, as well as Mr. Upton and Mr. Pitt's staff, Ryan Long and Clay Alsbach. Legislative Counsel Warren Burke and Megan Renfrew have additional 30 seconds I yield to myself. Warren Burke and Morgan Renfrew have done tremendous work on this bill. I'd like to express my appreciation for their efforts. I want to thank my own staff, Karen Nelson, Rachel Scher, Eric Flam, and Aaron Patel. The American public will benefit from the provisions of this bill. The FDA will have the resources to remain the gold standard for the future. This is an important bill, a good one. I urge its support, and I reserve the balance of my time.
Gentleman reserves. The gentleman from Michigan.
Mr. Speaker, I would yield 1 minute to the Chairman Emeritus of the Energy and Commerce Committee, gentleman from Texas, Mr. Barton.
Gentleman is recognized for 1 minute.
I thank the distinguished chairman to ask unanimous consent, revising consent, and revising
without objection.
Mr. Speaker, I rise in strong support of this bill. When the American public asks why can't Congress just work together, we should hold this bill up as Exhibit Number A, that it is possible. As the ranking member just pointed out, this is a bipartisan, bicameral, pre-conferenced agreement for a very complicated bill. We reauthorized the Food and Drug Administration user fee program for 5 years. We also reauthorized the medical device user fee program for 5 years, and I believe for the first time do one for generic and biosimilars. This is a complicated, complex piece of legislation, but it has been worked out in a bipartisan agreement. I have had some concerns about the extent and the cost of the user fees. I will continue to monitor that, Mr. Speaker, but this is a good piece of legislation. The chairman and ranking member and the subcommittee chairman and ranking member and all the others who've worked on this should be commended. This is an excellent bill, and I hope that the Congress will unanimously support it and the Senate will agree when we send it to the other body. Thank you.
Mr. Speaker,
gentleman from California.
At this time I'd like to yield 3 minutes to the gentleman from New Jersey, Mr. Pallone, the ranking member of the Health Subcommittee, the subcommittee that was responsible for this legislation in its first instance. And I'd like to ask unanimous consent that Mr. Pallone be permitted to manage the rest of the time on our side of the aisle.
Without objection. The gentleman is recognized for 3 minutes.
Brilliant speech. I want to make sure you guys know I'm here.
Thank you.
Okay, great.
Thank you, Mr. Speaker, and thank you, Chairman Waxman. I want to say I'm very proud to support the bill before us, which would reauthorize and revitalize a number of different programs at the FDA. This bill really represents a great compromise between the House and the Senate and strikes the right balance by including strong provisions that will be good for both innovation and patient safety. When we passed the House version of this bill, I spoke highly of a great cordial process, and I'm happy to be able to echo those sentiments again here today. This process should be a model for congressional bipartisan cooperation in the future. Not only did we all work so well together, staffs were able to rectify the differences among the two chambers' versions of the bill in a matter of 2 weeks. That's commendable. It's a clear indication that Congress is certainly capable of greatness if we just follow or allow ourselves to set politics aside and simply legislate. I want to thank Chairman Upton and Ranking Member Waxman for your leadership, and to all the staff who worked around the clock, and of course particularly Tiffany Guarocchio, who's my staff person. They were all dedicated to achieving a comprehensive and consensus product, and they've done just that. The bill before us today provides the FDA with more than $6 billion over 5 years to pay for the timely and efficient reviews of medical products. Together, these agreements will ensure that Americans have access to safe and effective new medicines and medical devices. It will reduce the drug costs for consumers by speeding the approval of lower-cost generic drugs with the establishment of a new user fee program for generic drugs and for lower-cost versions of biotech drugs as well. It also includes promising provisions that address the safety of the supply chain, help to foster the development and safe use of prescription drugs for children, increase efforts to address drug shortages, change conflict of interest rules so the FDA has access to the best expertise on their advisory panels, and other provisions which are important to the public health of our nation. This bill is good for the FDA, it's good for industry, it's good for patients alike. I'm confident we will pass this critical bill overwhelmingly today and that the Senate will act early next week so we can send it to the President for his signature as soon as possible. I urge all members to support this bill, and thank you, Mr. Speaker. I reserve the balance of my time.
The gentleman reserves. The gentleman from Michigan.
Mr. Speaker, I would yield 2 minutes to the distinguished chairman of the Health Subcommittee, Mr. Pitts from Pennsylvania. 2 minutes.
Gentleman is recognized for 2 minutes.
Thank you, Mr. Speaker. I stand to strongly support this legislation. This bipartisan agreement represents over 18 months of work from the Energy and Commerce Health Subcommittee, and I'm especially proud and appreciative of the hard work of Brian Long and Clay Alsbach for their diligent and tireless efforts in helping to make this bill possible. The FDA Safety and Innovation Act is critical to saving lives and improving regulatory operations and sustaining a vital and dynamic American industry. American companies are the leading developers of new medical devices and drugs to save and sustain life. To ensure that products are both safe and effective, we've tasked the Food and Drug Administration with reviewing products before they make their way into the market, and this is a critical responsibility. The device and drug industries are dynamic and innovative. Companies spend hundreds of millions of dollars and years of research and work to develop products. The review stage is a critical time for any company, and inconsistent reviews mean that the true cost of developing new products is hidden, making it difficult to properly prepare. When our Health Subcommittee began considering this legislation last year, we heard from a number of individuals about the increasing difficulty of working through the review process. American patients were waiting almost 4 years longer for new devices that had already been approved in Europe. And despite the slower U.S. review process, the safety outcomes were comparable. The FDA Safety and Innovation Act contains important reforms to the Medical Device User Fee Act and will hold FDA accountable and keep reviews on schedule. There are many reforms in this bill. Finally, we include language to help patients and doctors and hospitals deal with drug shortages. Mr. Speaker, I'm proud of the work we've done. I'm proud that we have such a bipartisan effort. I'd like to especially thank Ranking Member Frank Pallone, his staff, for patiently working with us. For Mr. Dingell, Mr. Waxman, we've accomplished much with this legislation, and it will help save lives, create jobs, two goals that we can all agree on. With thanks to our chairman, Mr. Upton, I yield back.
Gentleman's time has expired. A gentleman from New Jersey.
Thank you, Mr. Speaker. I yield now 3 minutes to our chairman emeritus, the gentleman from Michigan, Mr. Dingell, who worked so hard on this bill, particularly with regard to the safety provisions.
Gentleman is recognized for 3 minutes.
Mr. Speaker, I ask beyond consent to rise and extend my remarks.
Without objection.
Mr. Speaker, this is a good bill. I urge my colleagues to support it. I rise in strong support of it, and I urge my colleagues to join. This legislation enjoys broad bipartisan support on both sides of the Capitol and from industry and patient groups. We should also be proud of the work we have done to get it here today. I would observe that it has been done because the members work together in the finest traditions of this body. And I'm also proud of the work that my colleagues on the committee and the staff has done on this matter. I was pleased to work with them to include strong upstream drug supply chain provisions, something that's been a long priority of mine. And I'm also pleased that for the first time, commercial importers will be required to register, so we'll know who's bringing what in and whether it's safe or not. There will also be parity between inspections of domestic and foreign drug facilities, something which is a major problem because foreign facilities and foreign manufacturers now import much into this country, and much of which is unsafe and improperly inspected. FDA will be able to maintain a practice in which they will detain and destruct counterfeit drugs and those which are unsafe or intentionally or otherwise adulterated. And they will be able to impose increased penalties on those who adulterate these drugs and pharmaceuticals. These provisions, which mirror safety provisions in my drug safety bill, will equip FDA with the authorities it needs to better oversee our increasingly globalized drug supply chain. And it will give American families comfort that the pharmaceuticals that they're taking are safe and help to deter and to respond to any future heparin-like incidents which killed some 80 Americans and hurt thousands more. While I am disappointed we are unable to come forward with a consensus on a national track and trace standard, it's my hope that we will continue to work on this in coming days. And I want to commend my colleagues, Mr. Matheson and Mr. Bilbray, for the fine work they have done on this matter. I've also been working on this issue for many years, and we've come closer than ever before finding a consensus. Given additional time, I think we could have resolved this issue, but because of time pressures, we were not. I also want to thank my friends Mr. Upton, Mr. Harkin, Ranking Members Waxman and Enzi and their staff for the hard work which they did to send this critical bill to the President before July 4. I also want to thank Kimberly Trisiak of my staff for her diligence on the supply chain provisions and other matters. I urge my colleagues to support this bill. It will be something of which we will be proud. It will confer much safety on the American people in areas of very substantial danger, and it will see to it that to a modest degree at least, the industry-supported provisions, including those which involved the collection of fees, will begin to work for the benefit of the American people. I thank you, Mr. Chairman. I yield back the balance of my time.
Gentleman's time has expired. Gentleman from Michigan.
Thank you, Mr. Speaker. I would yield 2 minutes to the distinguished Vice Chair of the Health Subcommittee, Dr. Burgess. 2 minutes.
Gentleman is recognized for 2 minutes.
I thank the Chairman for yielding the Speaker for the recognition. Today, we are considering the Food and Drug Administration Safety Innovation Act, and I urge my colleagues to support it. This bill reauthorizes the Food and Drug Administration's user fee programs. The bill will allow industry to continue to partner in providing our physicians and provide them the tools they need to prevent and alleviate human suffering. The legislation retains significant reforms that were made in our House bill and enhances other provisions, such as those on drug shortages. The bill will ensure that the Food and Drug Administration has the scientific and medical expertise that they need when reviewing products utilizing emergent science or for those populations with very rare diseases. This bill will spur innovation for antibiotics, will help those with rare diseases, and be particularly helpful to the community of physicians that takes care of our pediatric cancer patients. The Food and Drug Administration is now required to notify Congress before issuing guidance regarding the regulation of laboratory-developed tests. I still believe we should strengthen and improve CLIA's oversight of laboratory-developed tests instead of even contemplating any type of duplicative regulation. The bill avoids provisions added by the other chamber that I thought crossed the line into the practice of medicine by Congress and actually threaten patient treatment. It will address numerous other issues to enhance the work of the FDA while correcting missteps of the agency in such areas as public input, good guidance practices, and the manufacture of custom devices. The process to this vote from the very beginning was respectful and resulted of hundreds of hours of negotiations. Chairman Upton, thank you, and Chairman Pitts, Ranking Members Waxman and Pallone. I specifically want to thank Ryan Long and Clay Alsbach on the staff of the majority who sacrificed much to get this product to the floor today. This vote is really about patients who will be served by the passage of this bill, and I urge its expeditious passage. I yield back.
Gentleman's time has expired. The gentleman from New Jersey.
Mr. Speaker, I yield 2 minutes to the gentlewoman from Colorado, Ms. DeGette, who worked very hard on the drug shortage provisions of the legislation.
The gentlelady is recognized for 2 minutes.
Thank you very much, Mr. Speaker. I'm delighted to support this bipartisan legislation which addresses critical problems affecting the safety of drugs and medical devices in this country. There are several highlights I'd like to talk about, like Dr. Gingri's incentives for antibiotic development, or the supply chain legislation that Mr. Dingell has worked on tirelessly for years. But there's one issue that I've been working on a bipartisan basis throughout this Congress that I want to discuss discuss briefly. Drug shortages have rattled our hospitals, our doctors, and our families. Figures recently released by the University of Utah shows there were 56 more newly reported drug shortages in the U.S. last year than in 2010, when there were 211. So again, let me say, 211 drugs in shortage. How can this be happening, and what can we do about it? Representative Tom Rooney and I from Florida introduced the bipartisan Preserving Access to Life-Saving Medications Act, which eventually had 85 co-sponsors. The bill creates an early warning system between the FDA, drug companies, and providers so a community can respond to a drug shortage quickly and efficiently. It won't solve the root problems of the drug shortage crisis, but it will help providers and doctors and hospitals identify those crises and help with the patients. This February, for example, under a voluntary program, the FDA stepped in to allow for temporary emergency importation of the cancer drug Doxil, which was in shortage. And at the same time, the FDA prioritized the review of a new manufacturer of the same drug when the cancer drug went into shortage. And so what our bill will do is make this program mandatory. What we think it will do is it will help patients across the spectrum get the drugs they need. It will help the hospitals and the providers identify potential shortages, and it will help the manufacturers better make sure that they get the drugs to the patients that need them. I'm thrilled that this is contained, and I want to thank the chairman.
Gentleman from Michigan.
Mr. Speaker, I would yield 1 minute to the distinguished gentleman from Florida, Mr. Stearns. 1 minute.
Gentleman's recognized for 1 minute.
Mr. Speaker, I ask unanimous consent that the attached letters that I have part of my speech be made part of the record.
Without objection.
My colleagues, this reauthorization of FDA user fees will provide stability for FDA's new product review as companies submit new and innovative drugs, medical devices, and biologics for approval. I'm especially proud that my bill, the Faster Access to Specialized Treatments, H.R. 4132, FAST, was included in the FDA Reform Act. FAST modernizes FDA's accelerated approval pathway to reflect scientific developments that occur over the past 20 years. This will allow new drugs for people suffering from rare diseases. There are 30 million Americans suffering from one of over 7,000 rare diseases, but only 250 currently have any treatment. FAST will save lives. So I'm pleased also that the bill includes the Expert Act, H.R. 4156. This will help FDA consult with medical experts when evaluating drugs designed for rare diseases such as cystic fibrosis. As a co-founder of the Cystic Fibrosis Caucus, I'm glad we're providing this tool finally to the FDA. I support passage of this bill and I'd like to enter my full statement into the record.
Gentleman's time has expired. Gentleman from New Jersey.
Thank you, Mr. Speaker. I yield a minute and a half to the gentlewoman from California, Ms. Capps.
Gentlelady is recognized for 1 minute and a half.
I thank my colleague for yielding, and Mr. Speaker, I rise today in strong support of the FDA Safety and Innovation Act. This bipartisan effort will improve the health and safety of the American people and at the same time support good jobs and innovation in the healthcare industry. I'm especially pleased that this bill includes two provisions which I authored. The first is modeled on my Safe Devices Act, and it will improve post-market surveillance of medical devices and implementation of the unique device identifier program. This essential provision will allow us to identify potential device problems early, thereby protecting patients and identifying issues when they are easier and less costly to address. The second provision I authored comes from my bipartisan Heart for Women Act, which the House has passed 2 times. It requires the FDA to report on the availability of new drug and device safety and efficacy data by sex, age, and racial and ethnic subgroups. Drugs and devices can have dissimilar effects among various populations, and this provision will help reduce substantial disparities in health care, especially for women and minorities. So I thank the Chairman and Ranking Members for their leadership on the FDA Safety and Innovations Act and for their support of these two provisions. I urge my colleagues to support this bipartisan bill, and I yield back the balance of my time.
Gentlelady yields back. The gentleman from Michigan.
Mr. Speaker, I would yield 1 minute to the distinguished gentlewoman from North Carolina, the Vice Chair of the Energy and Commerce Committee, Ms. Myrick. 1 minute.
Gentlelady is recognized for 1 minute.
Thank you, Mr. Chairman. The bill before us contains critical improvements to the current law. Among them is the creation of a priority review voucher program for companies that develop treatments for rare pediatric diseases. I'm pleased with this and other advances. But the long-term success or failure of crucial drugs and device approvals doesn't just depend on approving new funds and guidelines for FDA. It also depends on instilling a culture at FDA that seeks out practical solutions to the diseases that our constituents face. FDA must recognize that patients, especially those with fatal illnesses, deserve to have potential treatments made available. Whenever possible, FDA should use all the tools it has available to appropriately warn doctors and patients of risks associated with the treatment without removing patient access. Patients facing a fatal diagnosis, whether it's metastatic cancer, ALS, or otherwise, should be given the benefit of the doubt unless the treatment is very risky. This should be a guiding principle of the FDA and not simply a consideration. So I urge support of the bill.
Gentlelady's time has expired. The gentleman from New Jersey.
Mr. Speaker, I yield 1 minute to the gentleman from New York, Mr. Engel.
Gentleman's recognized for 1 minute.
I thank my friend for yielding to me, and I rise in strong support of S. 3187, the Food and Drug Administration Safety and Innovation Act of 2012. This is one of these rare occasions these days when Congress is working in a bipartisan manner to get good things done. This bipartisan, bicameral agreement is something of which we can all be proud, and is a prime example again of the good legislative work that can be done by this body when compromises are accepted. In particular, I'd like to thank the chairman and ranking members of the Full Energy and Commerce Committee and Health Subcommittee for their hard work to finalize this bill in such a timely manner. I would also like to thank them for including the reauthorization of the critical path public-private partnerships in this legislation, something which I've pushed for a long time, so needed improvements in regulatory science can continue. I believe this bill will help meet the needs of the FDA, industry, and most importantly, patients, and I look forward to its passage. I yield back the balance of my time.
Gentleman yields back. The gentleman from Michigan.
Thank you, Mr. Speaker. I yield 1 minute to the distinguished gentleman from Pennsylvania, Dr. Murphy. 1 minute.
Gentleman's recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Chairman, what good are life-saving drugs if you can't afford them? That's why real reform of the nation's health care system begins with promoting quality and affordability. I'm excited this legislation is moving forward because the FDA will finally have a system for bringing more life-saving generic drugs to market. Today's bill authorizes the first generic drug user fee program to expedite approval of generics, which are only a fraction of the cost of brand-name drugs. Generic medications can save a patient $1,000 a year in medication alone, but it may well yield billions in savings across our nation when affordable generic drugs are used to treat acute and chronic illness. Right now, consumers are spending millions, if not billions, more in out-of-pocket costs because the FDA doesn't have the resources to tackle 2,800 generic applications awaiting review. There will be fewer strokes, heart attacks, and cases of cardiovascular disease when this bill moves forward into law, and will be assured the medicine our families take is of the highest quality. Under this bill, regulators will no longer be able to look past China's history of tainted drugs like the 2007 heparin scare that killed 200 people. I'd like to thank Congressman Deal, Waxman, and Chairman Upton moving forward this bipartisan bill and urge adoption and yield back.
Gentleman from New Jersey.
Mr. Speaker, can I inquire about how much time remains on each side?
You have 6.5 minutes, and the gentleman from Michigan has 9 minutes.
Thank you. I yield now 1.5 minutes to the gentleman from North Carolina, Mr. Butterfield.
The gentleman is recognized for 90 seconds.
Let me thank you, Mr. Pallone, for yielding the time, and thank you so very much for your leadership on the Health Subcommittee. You do extraordinary work on our committee. Mr. Speaker, I rise today in support of S. 3187, the amended version of the Food and Drug Administration Safety and Innovation Act. I strongly support this bill and particularly pleased that the intent of H.R. 3059, the Creating Hope Act, sponsored by my good friend from Texas, Mr. McCall, and myself, was included in the final bill. I'm thrilled to highlight Section 908, the Rare Pediatric Disease Priority Review Voucher Incentive Program. The program will incentivize pharmaceutical companies to develop new drugs for children with rare pediatric diseases such as childhood cancers and sickle cell disease by expanding the cost-neutral priority review voucher program. Expanding the voucher program will allow pharmaceutical companies to expedite FDA review of more profitable drugs in return for developing treatments for rare pediatric diseases. I think that is a good trade-off. I would like to thank Mr. McCall and Mr. Waxman and Ms. Myrick and all of you who worked on this bill with us. I want to thank our Senate colleagues, Mr. Casey and Mr. Brown, for working diligently with me and our colleagues to see to its inclusion. Finally, I want to recognize Nancy Goodman with Kids vs. Cancer, who continues to be a tireless advocate for this issue. Thank you, Mr. Pallone. Thank you, Mr. Speaker. I yield back the balance of my time.
The gentleman from Michigan.
Mr. Speaker, I would yield 1 minute to the distinguished gentleman from California, member of the committee, Mr. Bilbray. 1 minute.
The gentleman from California is recognized for 1 minute.
Mr. Speaker, I stand in support of this bill, and I want to thank Chairman Upton and the leadership on both sides of the aisle for getting together and doing what's right for the American people. At this time that we've talked about economic strife, we've got to remember that the FDA can be a friend or an enemy of not only of our health but also our jobs and our economic opportunities. In California alone, Mr. Chairman, Mr. Speaker, we have over 267 people working in the pharmaceutical industry. We have over 42,000 just working in San Diego County. This bill will not only help to protect jobs, but this bill is a bipartisan bill to save lives. How much better a message we can send around to the American people that Washington is listening to the fact they want bipartisan support and bipartisan efforts and bipartisan successes on things that matter. This bill is something that matters. We're talking about preserving the economic opportunities of our fellow citizens, and we're talking about saving the lives of our family members and our neighbors. I'd like to yield back my time at this time.
Gentleman's time has expired. The gentleman from New Jersey.
Thank you, Mr. Speaker. I yield 2 minutes to the gentleman from Massachusetts, Mr. Markey.
The gentleman from Massachusetts is recognized for 2 minutes.
Thank you. I'd like to thank Chairman Upton and Pitts and Ranking Members Waxman and Pallone and their staffs for their work in bringing the FDA Safety and Innovation Act to the floor today. Passing this bill will allow the FDA to continue its critical mission of bringing safe and effective drugs and medical devices to the patients who need them. Reviewing drug and device applications has become increasingly challenging. Medical breakthroughs of today often target rare diseases of genetic subsets of those diseases. FDA reviewers must now assess a growing pipeline of very specialized treatments. I'm pleased that this bill includes language I helped author to improve collaboration between FDA and external experts in rare diseases like cystic fibrosis and sickle cell disease. The bill before us today also includes an important provision I helped author to ensure that the millions of Americans who are blind or visually impaired have safe and independent access to the information on prescription drug labels. No one should have to sacrifice their privacy or independence to access the vital information on these bottles, and I'm glad we're taking steps to address that here today. And finally, this bill helps increase the availability of pediatric medical devices and ensures that medications are tested and labeled appropriately for children. I was proud to work on these provisions with my colleagues, Congresswoman Eshoo and Congressman Rogers. I would have liked to have seen additional measures included in this bill to ensure the safety of medical devices based on defective models that have already been approved by the FDA, that unfortunately continue to be sold and jeopardize the patient's health all across this country. I am going to continue to work on this critical issue. I believe it's a problem we must solve. Once the FDA approves a device and then it turns out that there's a defect, there should be no excuse for allowing new companies to build their devices based upon the old, approved, defective model that the FDA had approved. Tens of thousands of Americans are put in jeopardy, and I would like to work to solve that problem. But nonetheless, this is an excellent piece of legislation, and I hope that the House gives it its overwhelming approval.
The gentleman's time has expired. The gentleman from Michigan is recognized.
Thank you, Mr. Speaker. I would ask unanimous consent that Mr. Dent's full statement in support of this legislation be included in the record at this point.
Without objection, so ordered.
And I would yield 2 minutes to the distinguished gentleman from Georgia, Dr. Gingrey, member of the committee.
The gentleman from Georgia is recognized for 2 minutes.
Mr. Speaker, I thank the gentleman for yielding. The FDA Safety and Innovation Act of 2012 may not be a great bill, but it is a darn good bill. And as a physician and a member of the Energy and Commerce Committee, I strongly support it. As my colleagues have said on both sides, this is a bicameral, bipartisan piece of legislation, and yes, we can get our work done. I want to particularly thank Chairman Upton, Ranking Member Waxman, Health Subcommittee Chairman Pitts, Ranking Subcommittee Member Mr. Pallone, and all of the members that have worked so hard on this really vast, huge bill that covers a lot of things, not the least of which, of course, is to provide 65% of the funding for the FDA so that they can indeed hire the best and brightest scientists so they can get their work done in a timely manner. Get new drugs to the market, medical devices, and bottom line, keep the health care system in this country the best in the world for our constituents and our patients. Mr. Speaker, I wanted to mention one particular aspect of the bill that I was very much involved in, and that's this issue of antibiotic shortage. The bill, as it stood alone, was called the GAIN Act, and I had a tremendous amount of help on both sides of the aisle. On the Democratic side, Congresswoman Issue, DeGette, Congressman Gene Green. On my side of the aisle, Mike Rogers of Michigan, Mr. Shimkus, Mr. Whitfield. And what we do with that portion of the bill is to provide an opportunity for the manufacturers of antibiotics to have 5 additional years of exclusivity. So that they can bring these innovative 5th and 6th generation antibiotics to the market and still have an opportunity to recoup the investment and the expense of doing so. So I want to just say to my colleagues on both sides of the aisle, it's a proud day, I think, for all of us, for Chairman Emeritus Dingell, former chairman on our side of the aisle, Mr. Barton, and everybody involved in this bill. I thank all of you. Let's all support unanimously this bill. And I yield back the balance of my time.
Gentleman's time has expired. The gentleman from New Jersey.
Mr. Speaker, I have no additional speakers, so I'll reserve.
Gentleman reserves. The gentleman from Michigan.
Mr. Speaker, I would yield 1 minute to the gentleman from New Jersey, Mr. Lance, member of the committee.
Gentleman from New Jersey is recognized for 1 minute.
Thank you, Mr. Chairman. Mr. Speaker, this legislation will ensure that patients get improved access to innovative, life-saving therapies and medical devices while protecting and creating U.S. jobs. The bill is critically important to New Jersey, where we have a high concentration of medical device, pharmaceutical, and life science employees. I am pleased that the conference report contains provisions important to streamline and modernize FDA regulations while promoting patient safety. Just as important, today's measure is fiscally responsible, reducing the deficit by $311 billion over the next 10 years, according to the CBO. I thank Chairman Upton, Chairman Pitts, Ranking Member Waxman, Ranking Member Pallone, and members of the Energy and Commerce Committee for working together in a bipartisan capacity on a final bill that protects patients and brings much-needed certainty to the medical and biopharmaceutical industries. This is the way Congress should work. I yield back the balance of my time.
Gentleman from Michigan.
Mr. Speaker, I would yield 1 minute to the gentleman from Kentucky, Mr. Guthrie.
Gentleman from Kentucky is recognized for 1 minute.
Thank you, Mr. Speaker. I appreciate the gentleman for yielding. I rise today in support of the legislation to reauthorize the Prescription Drug and Medical Device User Fee Acts and authorize new user fee programs for generic drugs and biosimilars. The legislation also includes important reforms to grant patients improved access to new therapies and promotes innovation and job creation. Jobs in the economy are top issues for most Americans, and this bill focuses on that. As a manufacturer, I've heard many stories from many device manufacturers across the country about problems they face with the FDA and how those struggles are making it harder for them to manufacture in America. This bill includes important changes, including one that I championed, to reform the FDA's guidance process that will inject certainty into the process and create more American jobs. This bill is an example of working in a bipartisan way to achieve a quality product that creates jobs. I thank the Chairman and the Ranking Member for that work, and Mr. Speaker, I urge my colleagues to support this bill, and I yield back.
The gentleman's time has expired. The gentleman from New Jersey has 3 minutes left, and the gentleman from Michigan has 4 minutes left. Gentleman from New Jersey.
30 seconds or so. Mr. Speaker, I'd yield 30 seconds to the gentleman from Virginia, Mr. Moran.
Gentleman from Virginia is recognized for 30 seconds.
Thank you, Mr. Chairman. I don't oppose the bill, but I do have concerns about one element of this bill, and that is what affects whistleblowers. The law that would apply is that of the military, the Defense Department, which frankly is weaker than applies to protecting whistleblowers who are in the civil service, civilian whistleblowers. And I do think protection of whistleblowers needs to be a priority, and in this case I would hope that we could work in subsequent legislation to protect the rights of whistleblowers who are essential to our being able to do our job, as well as those people in the executive branch. So I just wanted to make note of that point. Thank you, Mr. Chairman.
Gentleman from Michigan.
Mr. Speaker, I would yield 1 minute to the gentleman from New Hampshire. 1 minute, member of the committee. Mr. Bass.
Gentleman from New Hampshire is recognized for 1 minute.
Mr. Speaker, I rise in strong support of the Food and Drug Administration Safety and Innovation Act, and I thank the distinguished chairman of the committee for recognizing me for 1 minute. The user fee process at the FDA is a vital element in maintaining operations at the FDA to bring valuable drugs and devices through the approval pathway and to market. I'm optimistic that with enhanced financial incentives and resources available to the FDA included in the user fee agreements, we will see shorter approval times and more products available to patients. Throughout this process, there's been a commitment to addressing the unique issues associated with the rare disease community and bringing it to the forefront of this debate, and I'm proud to have had my bill, the Humanitarian Device Reform Act, included as a provision in this device regulatory section. This language will make it easier for medical device manufacturers to create devices specifically for the treatment of individuals, both children and adults, who are afflicted with very rare diseases. With this increased focus on providing incentives to manufacturers to invest in the development of these devices and drugs, it can be an attainable goal for an individual and family afflicted by rare diseases not only to improve the quality of life, but possibly even find a cure. I rise in support of this bill and yield back.
Gentleman from Michigan.
Mr. Speaker, I would yield 1 minute to the gentleman from Minnesota.